USMLE Step 2 CS: How to Master Patient Encounters. Imagine walking into an exam room and having just 15 minutes to impress with your clinical skills. The clock is ticking, and every second counts. Mastering Patient Encounters for the United States Medical Licensing Examination Clinical Skills part is all about preparation, focus, and clear communication. You need to gather the right information, perform a focused physical exam, and document everything efficiently. It sounds simple, but it takes practice. Start by managing your time wisely. You get 15 minutes for the interview and physical exam, then 10 minutes to write your patient note. Keep an eye on the clock. Don't spend too long on unnecessary details. Focus on the main points that relate directly to the patient's chief complaint. For example, if a patient reports chest pain, ask about onset, duration, and any related symptoms like shortness of breath or sweating. Then perform a physical exam that targets the chest and heart, rather than a full-body check. Being efficient helps you cover everything without rushing. When you begin talking to the patient, use open-ended questions. Ask what brought them in and listen carefully. Use simple language so they understand you. Show empathy by maintaining eye contact and nodding. Summarize what they tell you and ask if there's anything else they want to add. Clear communication builds trust and helps you gather accurate information. Remember, your goal is to understand their story without interrupting or rushing. Take a systematic approach to history taking. Cover key areas like onset, duration, severity, and what makes symptoms better or worse. For example, if a patient has a cough, ask how long they've had it, if it's dry or productive, and if they notice any fever or chills. When performing the physical exam, focus on relevant findings. For chest pain, listen to the heart and lungs, check for tenderness, and look for signs of distress. Keep the exam professional and respectful, always draping the patient properly. After the encounter, use your 10 minutes to write a clear, organized patient note. Include the main points from the history, physical exam findings, and your initial differential diagnoses. Explain your reasoning briefly and outline the next steps, like ordering tests or treatments. Your note should reflect your clinical thinking and justify your choices. Practice makes perfect. Use standardized patients or classmates to simulate real exams. Practice helps you get comfortable with timing, handling different patient behaviors, and staying calm under pressure. Remember, the exam also tests your ability to interpret data and communicate effectively in spoken English. Practice these skills together to improve your overall performance. Finally, stay professional and confident throughout. Even if a patient is difficult or forgets details, keep your composure. Show empathy, listen carefully, and be respectful. These qualities matter just as much as your clinical knowledge. With consistent practice, good time management, and clear documentation, you can excel at mastering patient encounters for the USMLE Step 2 Clinical Skills exam.